Hello, everybody, and welcome back to the Nonprofit Spotlight series. Today, we are joined by Carla Moore, and she is the CEO of United Methodist Community House. And they are really all about strengthening their community across the generations. They have services that help and provide support and care for all ends of the age spectrum. Carla, thank you so much for joining us today. Tell me a little bit more about the work that you're doing out there.
Yeah, thanks for having us. So, UMCH really provides care and education in the early childhood education space. And we also provide programs and services to older adults. We do a little bit of work with elementary age students throughout the school year through after school programming, as well as during the summer through a summer fun club. And we really do try to address food insecurity. So, a lot of the work that we do is driven by data that comes from our community needs. And so we are currently involved in a fairly major expansion of our organization. And part of that includes our early childhood education. Where we are located, there's only one seat of licensed care for children who are age 0 to 2. There's only one seat for every 10 children that age. And so we have a gross deficit. And so when you talk about how do we strengthen our community? How do we ensure that everyone has the resources they need to succeed? Parents need care
Yeah.
and educational resources for their children so that they can go out and in turn care for their families. And so that's a really important component for us. The other thing is the way that our community is situated. A lot of the model is you retire and then you move on out to a fancy retirement community where everything is brought in for you. And what that really does is it leaves those who may not have those capabilities to reside in the urban core, and the connectivity to resources is often lacking because our resources are scattered throughout community. And so we have no dedicated older adult center in the city of Grand Rapids. Our surrounding communities have them. And like I said, we have those fancy retirement communities on the outskirts. And so we've embarked upon a project that will help us to develop a major activity center for older adults. And so that's kind of what we're up to. There is one final component of that, and that is housing, which we know is a national crisis. And it really has to do with stock, right? The lack of stock drives up the cost and all of those kinds of things, and it needs to be affordable. And so United Methodist Community House has partnered with another local organization called Samaritas, as well as the Grand Rapids Housing Commission to build 50 units of affordable adult living for older adults right next door to our campus.
It really sounds like y'all are creating this entire kind of almost campus for your community out there. And I love that. Something that you briefly touched on that I'd love to hear a little bit more about. You mentioned that food insecurity is a big need or is a big concern within your community. I know that y'all have that incredible
Fresh
farm to
market.
table fresh market. Exactly. Can you tell me a little bit more about the idea behind that and the need that that serves?
Yeah. So when we were looking at, including housing into this overall vision for how we would, answer community needs, we began to study what makes a robust and sustainable community. And there were some core elements that should be present for a thriving community. And having access to fresh food was one of them. While also trying to get a grocery store to come down to where we're located in the urban core just was not feasible. It just was something we couldn't attract and do. Around that same time, another local organization called Access of West Michigan reached out to us and asked, would we be willing to launch a fresh market? Well, food retail is certainly not in our wheelhouse, but it aligns so perfectly with our ability to answer that need, right? And so we launched a fresh market. It started with just a couple of produce bins. Today, it boasts pantry staples, some bulk goods. We do have some dairy and cooler items, as well as some freezer items now. And then part of our older adult center, we provide congregate dining. And based on some of the feedback that we've heard from older adults, um, you know, the traditional congregate dining site feels like a soup line almost. And so what we've
Mm,
done is in this development, we've launched a cafe that is congregate dining eligible, right? And so it's the only site in Kent County where diners can come in and they have a menu that they can order from. And the buffet is one of those menu option items. So the buffet hosts kind of the traditional monthly menu. And then there's some entrees that they can order that meet the USDA guidelines for nutrition. And it just gives them choice. It gives a different type of feel in the dining environment. And nutrition is so important, especially to our aging population, that we want to make sure that we did that right.
That's amazing. It really sounds like it would give them the agency to kind of choose and to make that decision, and something maybe that they're not able to receive
Yeah,
with the kind of standard system that's in place right now.
that's
That's
what it's
amazing.
about.
Another thing I would love to briefly dive into is that I think you've been at the organization for a little over 10 years. How have you seen the need change over that time? And I know that y'all are doing a great job of fulfilling that. As you mentioned as well, looking into the future, only 1 in 10 seats in terms of, I think that was the early child care is being filled in your area. What are y'all looking to and kind of improve on that number going to the future as well?
Yeah. So we will be moving over all age spans in the early ed space. So that's 6 weeks, years of age through 5 years old when they leave for kindergarten. We will be moving from 70 seats to 144 seats. So a little more than doubling the seats that we're able to offer. Certainly, that's a huge need out there, and we can't answer it all, but we can do our share, right? And so we are one of many organizations and entities trying to address the need for access to seats.
And then how have you seen that kind of change over the time that you've been there? And also as the organization has grown, and it sounds like you've also grown with it, how has that been?
Yeah. I've really enjoyed my experience here. I actually came at September 1st of 2010. So, um, and at that time, my role was HR. So I came in an HR capacity. And I quickly began to do a few other things until the hat just became so large that we hired another HR person and I moved into director of operations. And that's where I got to, really work on building, that programmatic infrastructure. The way that I've seen needs has really been interesting. We've had a robust early childhood program for many, many years. That's one of the things that this agency has been known for. And going through the pandemic really created some shifts. Just before the pandemic in 2017 is when the needs assessment study was conducted initially that talked about the 2,400 children residing, with so few seats available. And the study was performed again post COVID just to understand what the effects of the pandemic were. And basically, those numbers held really, really strong. And in some areas, they became a little worse because what we saw is the closure of some centers who weren't able to weather the pandemic. A lot of home based cares closed
Hmm.
during that time frame. And so we know that childcare and development programs for them are really, really essential and even more vital now. And so we've just seen that need increase. In terms of older adults, um, AARP's national office out of Washington, D.C. had assisted us with a sample survey of Grand Rapids proper. And it's really been the blueprint for how we've designed our center and determined what amenities would be available in it. And so that data came from that study. And, older adults really do lack a lot of times, just that motivation to get out and actually connect. It's so difficult as you're aging and you begin to lose your peers, whether it's they've moved away, they've passed on, those things really impact, kind of that mental health aspect
100%.
and the things that they're dealing with. And so being able to create a place that is accessible because we also provide assisted transportation. So they get door to door service if that's what they need. And having programs and activities that are full of their peers that allow them to regain and build that sense of community that sense of someone's waiting on me, that's how we begin to improve lives there. And so that's really been fun to watch as, every year there's another crop of, eligible folks. So just watching the community grow and thrive is has been what's most exciting.
I love that, and it really sounds to me like you are informing the decision they are making based off the community needs, and data is a key component of that. I would love to understand how you are using that data to craft a compelling story to go to your donor base and your constituents that are supporting your work, and how has that been? How has, garnering support for this important need that y'all are filling that you're seeing is not being met by the overall system? Tell me more about how these conversations are.
Well, so UMCH is well over 100 years old. So it's been around and knocking on doors for money for a long time, right? And so as we began to look at, so one of the drivers for all of this is to help us to create long term financial sustainability for the organization. And I think that that's a key component for nonprofits to understand is
Especially this year.
how can they create a long-term sustainability plan? Because what you don't want is donor fatigue, right? You've got to have a good strategy in place, and a good strategy is going to have data that backs and supports what it is that you're trying to achieve and accomplish. And so we did spend a lot of time on the front end collecting and gathering that data. Matter of fact, before we even launched any kind of feasibility, we spent a year doing kind of a visioning tour with community leaders, funders, stakeholders. And that really kind of helped to inform and shape how we crafted our strategy and our vision for how we can bring financial sustainability, answer documented community needs. And that has got funders excited and donors excited and wanting to be a part of it.
That's amazing. You mentioned, can kind of, as we're wrapping up, the financial sustainability. How are you seeing that in your organization in terms of, are y'all building a revenue source outside of a donor base? Is it kind of grants playing an important piece? What does that look like for your organization?
Yeah, so we are building internal revenue streams, ways that we can bring revenues in so that we can decrease our dependence on grants and donations. That's our overarching goal. And that's being done in a number of ways through various programs that we have existing that we are finding ways to expand and expound upon, as well as new offerings through recreational opportunities and things of that nature.
That, and as we're kind of looking towards the end of the year, what is going on outside of the new expansion and the new construction? What's going on in your organization?
Yeah, it's kind of the routine things. We're getting ready to move into that holiday season. Clearly, we're not in that space where we have ended all fundraising activities. So we'll be doing all the traditional activities, year-end appeals and impact stories and all of that good stuff. But, we opened phase 1 of our older adults center. And so that is operating. And so we have expanded space. We're looking forward to some really fun holiday celebrations and things like that with the folks that come and engage with us. Our child development center is thriving, and so we're really excited about that. Matter of fact, they have active construction going on right now where we're
Amazing.
doing some upgrades of spaces. And so that's really kind of what the year looks like for us. As we look to the year ahead, we are looking for continued action and movement. We will launch phase 2, which will bring in some of the broader recreational spaces and community spaces of our expansion on our campus. We probably will see towards the middle to end of that year, construction launching on housing. And so it's going to be an exciting year ahead.
That's amazing. And how would our audience get involved with the work that you're doing out there?
Yeah, you certainly can reach us on the web. So, umchousegr.org is a great place to start. We have pages on there that have our information, our programs, contacts, email addresses, and things of that nature. Giving is accessible on the website as well. Support is always welcome. We do have a volunteer application if you're local. We love to host volunteers. And so that's always an opportunity.
Well, Carla, thank you so much for joining and sharing more about the incredible work that you're doing with the UMC House. Just really making an impact across all generations for your community. I appreciate you taking time to join the show.
Yeah, thanks for having me.